Thank you everyone for joining us. Welcome to the latest Duke media briefing on the COVID-19 pandemic and its effects on society. I'm Greg Phillips with Duke Communications and I'm here to moderate. We have three Duke scholars with us today to discuss the economic impacts of the pandemic on families. I'll introduce them in turn, get the discussion going, and then we'll open it up to questions. We are recording this briefing and we can make that recording available afterward upon request. And again, everybody except the speakers is currently on mute. Please stay muted until we get to questions. So, with us today, we have William Sandy Darity, a professor of public policy, African and American studies and economics, who specializes in wealth and income disparities. And Darity also directs the Samuel DuBois Cook Center on social equity. Good morning.
Morning.
Andrew Foster is a professor of law and director of Duke Law School's Community Enterprise Clinic and teaches courses in community development law. Andrew, good morning.
Morning.
And Anna Gassman-Pines is an associate professor of public policy, psychology and neuroscience and works with the Center for Child and Family Policy. She studies low-wage work and family life. Anna, good morning.
Good morning.
And I'd like to start with you. You've been surveying service workers with children to assess the social and economic impact of the pandemic on service workers with children. What effects have you seen?
So we were actually studying service workers and their children before the crisis unfolded. And we were in the process of collecting daily survey information where service workers told us whether they had worked that day, what hours they had worked, and a little bit about how they and their children were faring. And we were tracking the reports about their work and their well-being every day, right up until the city where they were working imposed restrictions because of the COVID crisis. And what we see is that immediately after those restrictions on non-essential businesses were put into place, as you would expect, work hours decreased dramatically, and well-being also dramatically decreased, both for parents and for their children.
Gotcha. Okay, fantastic. We certainly want to dig into that a little bit more as we get into this. But I want to ask Professor Darity an opening question. In states that are measuring cases by race, the virus is disproportionately affecting Black Americans. You've spent decades researching racial disparities in this country. I mean, what are some of the factors influencing the disparity in hospitalizations and fatalities from the virus?
So there are two central factors. One of the factors is associated with the deep historical residue of health disadvantage that already was embedding itself in the Black community, particularly with respect to what people now refer to as pre-existing conditions, which would be inclusive of hypertension, heart disease, diabetes, and the like, which would make people more vulnerable to the worst outcomes that might take place as a consequence of being exposed and infected. But there's also another central pre-existing condition, which is associated again with the long historical trajectory of racial injustice in the United States. And that is the vast wealth disparity that exists between Black and white Americans. So Black Americans constitute approximately 13% of the nation's population, but only possess about 2.6% of the nation's wealth. This translates into an average gap per household of approximately $800,000 by race. This immense differential means that under any emergency circumstances, Black families have considerably less resources to function as a cushion, and they do not have the resources to have access to the best healthcare or the best preventive measures to ensure that one has better health. And so as a consequence, we're seeing these staggering numbers that are associated with racial disparities in the mortality from COVID-19, where, for example, in the state of Louisiana, Blacks constitute about 32% of the state's population, but 70% of the deaths from the coronavirus.
Right, absolutely. So we've got now two pictures painted there of some of the effects of the virus. Professor Foster, you've argued that the $2 trillion rescue package that the US government's proposing is just a good start. What more should and can the government be doing to help working families?
Sure. So, I think just to build off of what my colleagues have said, I think a lot of us have a sense of the context, but we do come into this crisis in a society which is deeply unequal, and I think we can't forget that that is our starting place. The other thing is that even when you sort of try to just look more generally at the economic inequality, which becomes much more profound when you add in the race and racial characteristics that Professor Darity talked about, we're talking about a situation where, close to 40% of Americans have less than $400 of savings. Recent Nielsen study showed that around 50% of all working class families that earn less than $50,000 live paycheck to paycheck. Most households have significant amounts of debt. So people just are not well positioned for the disappearance of work. And if you step back just a couple months, at the end of the end of February, we were looking at unemployment of 3.5%. Today, it's probably about 15%, and it could easily be 20% by the end of this month. So, $2 trillion is a lot of money, but against this kind of historic crisis, it really is just a drop in the bucket. I think that there needs to be, very briefly, three things to establish really broad-based relief that then you could start building on with more targeted interventions for particularly vulnerable populations. The first is that the $1,200 or $2,400 checks that the IRS is starting to send out hopefully this week. That's a one-time payment right now. That really needs to become a monthly payment so that low-income and middle-income families have a regular source of income for the duration of this crisis. The second thing is that we really do need to significantly invest in small businesses so that they're able to maintain their workforces, because it's much harder to get people re-employed than to keep them employed. So the CARES Act has this program called the Paycheck Protection Program, which is designed to do exactly that. As many people know, it got off to a really rocky start, but it is seeming to start it now seems to be working pretty effectively, but it is significantly underfunded. There's evidence that shows already over $1 trillion of loan requests have been submitted, and the program's only funded at $360 billion. So you probably need another $1 trillion to $1.5 trillion for that. And then third is that states are on the front line of fighting both the public health crisis and the economic crisis, and they're starting to face their own fiscal cliff. The National Governors Association has asked for $500 billion, and we need to meet that. So if you put just those three things together, which again, I think is really just the floor or the minimum of what you need, that's about another $4 trillion. And then that would let you start investing in the more targeted interventions that are needed for particularly vulnerable populations.
Okay, thank you ever so much for that. So we've got an awful lot to dig into here. Certainly, I've got plenty of questions of my own, but I'd like to open it up to the reporters and others that we have on the call to unmute yourselves and ask a question. As I'm sure you're mostly familiar, if you're using the Zoom app, you can tap the screen and unmute yourself in the bottom left corner. If you're calling in from a cell phone, you can use *6 to unmute yourself. So if anybody has a question, please let us know who you are and where you're calling from, and we'll hear your question. Okay. While people are figuring this out or maybe pondering their own questions, I have plenty. And so I'd like to come back to you, Anna, first of all. You mentioned there about the drop-off in social well-being that has accompanied the drop-off in hours. Could you tell us a little bit more about what you're seeing, what the implications of this drop-off in social well-being are?
Sure. So we ask parents every day to tell us, how much of the time today did you feel sad, angry, fretful, or irritable? And was that not at all, some of the time, or all the time? And what we see is that before the crisis, about 6.5% of parents, on average on any given day, said they felt that way all the time. After the crisis, that number more than doubled to about 14% of parents saying they felt those negative feelings all the time. That is a huge increase in psychological distress, which follows from exactly the types of things that my colleagues were talking about. Parents also reported about their young children's behavior and asked how much of the time today did your child act uncooperative, which to many parents may seem like, you know, a lot of young kids are uncooperative, but being uncooperative all the time or most of the time can be a sign of serious behavior problems in kids. That's kind of an acting out behavior that is a way that young children show their own distress. And we also see similar huge increases in the number of parents saying that their young child is acting uncooperative nearly all or all the time on any given day after the crisis. And this follows from huge amounts of job loss that we observe in our surveys. So when we went back to these same families and said, have you been laid off? Has another adult in your household been laid off? The majority of families in our survey have had at least one adult experience a layoff since the crisis started. And not surprisingly, families have also experienced big decreases in income as a result of the crisis. This follows from their loss of work. And so what they're then telling us in the surveys is because of these decreases in income, they are not going to be able to pay their basic bills, rent, utilities, food or grocery bills, starting this month. And this speaks exactly to what my colleagues were just talking about, where the majority of service workers do not have savings. They are not well positioned to weather this kind of serious crisis. And when they become disconnected from work, that is having an immediate impact on their ability to cover basic living expenses.
Right, absolutely. Sandy, I'd like to move over to you before I open it up again. You know, what Anna's just described, and then we've got Andrew's depiction of what should happen. But as you mentioned, you know, America comes into this crisis with so much inequality and disparity to begin with. So when you hear Andrew discussing some of the things he thinks should happen, how do you think that should be calibrated to address the racial disparity that we're already experiencing going into this thing?
Well, I think one of the things that Andrew was emphasizing is that the types of disparities that we're talking about in terms of disadvantage, particularly with respect to employment, is fairly widespread, but it disproportionately weighs upon Black Americans. But to the extent that it's fairly widespread, particularly for folks who are in personal contact, personal service employments that require close connections to your customer base at a time in which we are trying to minimize close connections between individuals and trying to minimize the presence of large gatherings, that means that the odds of job loss are extraordinarily high for those individuals. Or if they are in personal services, personal contact employments that we deem essential at the present moment, particularly folks who are working in the healthcare services and in the hospital sector, then they themselves are at greater risk for infection from the disease. So it's somewhat of a prisoner's dilemma. Either you lose your job or you keep a job that's one in which you're going to be exposed to a high level of danger. So from my perspective, there's two sorts of strategies that need to be pursued. One set of strategies is what I might call universal policies. Those are policies that would be applicable to all Americans. They may, in fact, have a disproportionate benefit for the most vulnerable communities, including the Black American population, but they would be programs that would apply to all Americans. And then I'm going to talk more specifically about a program that would be dedicated to improving the status of Black Americans. But let me go to the first category. I've been a longtime advocate of what we refer to as an economic bill of rights for the 21st century. And included in that are a couple of policies that, if they had been in place at the point at which the crisis hit, we would have been in a much better position to cope with this crisis. But it's not too late to adopt these policies. So the first is an obvious one, which is a program of national health insurance, which would have guaranteed that every American citizen could take the dollar sign out of their capacity to access adequate health care and adequate medical care. The second is a federal job guarantee, which would be a policy that would ensure that every adult American could find employment through the public sector. If we had had this in place, then we would not have to worry about repeated tranches of payments to individuals, because folks would already be on the public sector payroll, and we could just continue to pay them, even if we're making a transition from having them work in employments where personal contact is required toward employments where less of that would be required, or our industrial engineers recreate the workplace so that we could have production take place or services provided with the appropriate social distancing protocols. In addition, it would have been possible to have provided employment for individuals who rely heavily upon mass gatherings for their income. So I'm thinking about artists and entertainers. Just as we employed artists, entertainers, and writers during the work in the Works Progress Administration during the course of the Great Depression, that could have been done again under a federal job guarantee. And we could also rejuvenate our postal system, which is under intense assault at the moment. But we could rejuvenate it by having persons who were employed through a federal job guarantee become part of the staff of the postal system, again, pursuing appropriate social distancing protocols. I'd also add that another universal policy that strikes me as absolutely essential in this moment is universal access to publicly provided Wi-Fi services. This includes not only the internet itself, but also the instruments or machinery that people would need to access the internet. So those are universal policies that I think could have a very strong effect on improving people's status and allow us to better deal with a rapidly evolving economic depression. In terms of policies that would be specific to the status of Black Americans, I'm a longtime advocate of a reparations program for Black Americans that's specifically designed to eliminate racial wealth disparities. Since I view that as a core pre-existing condition that has made Black Americans more vulnerable in this present moment, if we were to eliminate that pre-existing condition, then we could move closer to a position of equity.
Absolutely. Thank you very much for that comprehensive answer. Again, I've got more questions of my own, but I do want to open it up to everybody on the call. I submitted a moment ago in the chat that you can also submit questions via chat if anybody's having trouble unmuting themselves or would rather ask a question that way. But if anybody on the call has a question, I'm going to give everyone a moment to unmute themselves. Let us know who you are, where you're calling from, and to whom you'd like to address a question. Go ahead.
Hi, this is Sarah Obaska from North Carolina Health News. My question is for Professor Gassman. Can you give a little bit more details about this study, whether these were North Carolina residents, kind of the size, and then also I'd like to hear your thoughts on the effects of child welfare in these situations when you've got, you know, kind of what are the downhill effects of job loss in kind of low-wage families and kind of the concerns that this crisis has brought up.
Sure. So this study was not conducted in North Carolina. It was conducted in a large city in the Northeast that has had a pretty typical progression of the kind of outbreak of the disease, not something where it's gone off the charts, but at the time that the city closed non-essential businesses, there were a few hundred confirmed cases, and that city in many ways is kind of typical of large U.S. cities. But you raise a really important question about child welfare that we really all need to be thinking about, especially in terms of added risks for already vulnerable families. I know from my own prior work that's looked at earlier economic downturns, kind of more standard economic downturns through the business cycle, and I and my colleagues have shown that when there are large-scale job losses in communities, child maltreatment rates go up. That's true of both neglect, which is typically driven by poverty, and of abuse. And so we all need to be thinking about, during this time of stay-at-home orders and widespread economic strain that families are experiencing, that those are the conditions under which families with pre-existing vulnerabilities might be under a lot of increased strain and stress. We see that in my ongoing work, but connecting it with the prior work. And this is a real challenge for our social services system, the child welfare system, which, much as Sandy described, relies on social workers having face-to-face interactions with families, and will now require a reorganization of how they do their work. But it's a crucially important question for the health of North Carolina children.
Excellent, thank you for that. I hope that answered your question. We'll certainly have time for a follow-up. But right now, I'd like to see if there's anybody else on the call that has questions. You can submit them via the chat or unmute yourself and ask away.
Hi, yes, this is Jim Tankersley from the New York Times, and my question is for Professor Darity. I'm just really interested in the way in which this crisis has revealed and exacerbated the wealth effects that you've studied for so long. And I'm curious what you see going forward as the likely aftershocks of this crisis, no matter how long it lasts. What will the racial wealth gap look like next year, the year after, and how policy dependent is that?
So I'm pretty bad at forecasting. So this is going to be a very rough stab in the dark. But I think that on the side of income as opposed to wealth, the first thing we have to consider is the vast amount of job loss that's going to take place. And we know that historically in the United States, the Black unemployment rate is consistently 2 times the white unemployment rate. And that's true regardless of educational attainment. So this has always been the case from the time in which we first began to collect unemployment statistics in the United States. So people are projecting that the national unemployment rate is going to run as high as 30% or even higher, possibly. And if the overall unemployment rate is in the vicinity of 30%, then the projected unemployment rate for Black Americans could run as high as 50%, which is absolutely staggering, and is a number that we have never seen in this country. So there could be immense and devastating income effects that could be associated with the evolving depression. But in terms of wealth effects, if anything, I would argue that probably the existing policies that we put in place, like the CARES Act, disproportionately benefits individuals who already are relatively better positioned because of the amount of resources that are going indirectly to workers, because they have to be delivered as the pass-through to the to small businesses, but also fairly substantial large corporations. And so we might actually observe a further worsening in wealth disparities, both in general and with respect to the racial wealth gap. I'd be hard pressed to put a real number on what that's going to look like, but it's been horrendous in recent years. And I could only imagine that those kinds of disparities would get worse in the absence of any significant policy intervention.
Sandy, thanks for that. I'd also, and Jim, I'll give you an opportunity to follow up. I'd like to ask Andrew if there's anything that you'd like to add to that. You outlined, some steps the government could take, but they're certainly not taking those steps right now. So what you feel like the ramifications could be, if there's anything you'd like to add.
Yeah, I mean, I guess two things. One, most specifically to build off of what Sandy just said, I think, it is challenging. We come into this with the system that we have. And so it would be great to have a way to more directly distribute both income and wealth support to families directly. But, we basically, you can see this in the way the unemployment system is working right now, right? I mean, at one level, it's just not staffed to address the level of demand. The other is it's really designed to minimize the number of people who benefit from unemployment. So in North Carolina, for example, the pretty conventional estimate is about 90% of people who are unemployed are not able to get unemployment through our system. So, we have some government systems that are designed ostensibly to provide a safety net, and they do provide. I don't want to minimize the benefits that they provide, but they are in large part designed to not provide long-term support for folks, right? We're trying to get people towards some concept of self-sufficiency and out of the public support system. So we don't have a safety net that's well designed for this or staffed at the level that it needs. And we don't have in place things right now like a national jobs guarantee. And I think it would be great to have. But I also think seeing how hard it's been to roll out something as relatively straightforward as the Paycheck Protection Program that leverages these huge financial institutions that we have and all of the lending capacity in those institutions, how difficult that has been. And now that we see, the need, the most we're talking about is giving it another 250 billion. I worry about, I think long-term, this creates real opportunities for thinking creatively and boldly and morally about the kind of society that we want to have and where we want to build to after. But when we think about, just a quick story, one of the clients we work with is a nonprofit in Durham that is 100% self-sufficient from earned income, and it employs, it did employ 50 people, most of whom were returning citizens from incarceration or people with developmental disabilities. On March 1st, they were planning to hire 4 more people. By the middle of March, they had laid off their entire staff. I think most immediately my concern, against the backdrop of what both of my colleagues have talked about, we know domestic violence is going to increase. We know that hunger is increasing. We know that child abuse is going to increase. Right now we have eviction moratoriums, but low-income families don't have the money that they're going to need to pay back rent in 90 days when those eviction moratoriums are lifted. So, for me, the real question is, given the systems that we have and the political reality that we have, how do we direct as much immediate income support to families so that they can get through this storm and we can get to some level where we can then begin thinking about the kind of society we want to build, so when this happens the next time or when we get back to whatever the new normal is, we don't have the kind of racial and economic inequality that we faced coming into this.
Gotcha, absolutely. This is extremely weighty stuff. I'm going to open it up again to questions from the gathered here. You can submit them via chat or feel free to unmute yourself and ask a question. Okay, we are staying quiet at the moment. But fortunately, I have plenty of questions. And I'd like to come back to you. You know, we've got a very bleak economic picture right outside the window and being painted here. Given what you've already seen and some of the social effects that you've discussed, and especially, you know, the impact on the social safety net and child welfare, what are some of your biggest concerns over the next couple of months? Beyond, you know, we know that people are struggling to pay their bills and maybe there won't be enough help. What are some of the things that you're worried about that maybe you haven't seen discussed in headlines yet?
Well, so there are a few things I want to say about that actually relate back to comments that my colleagues have made. One is, I think we all need to be on the lookout for the emergence of serious mental health problems, especially among young people. In my own prior work, I have shown that economic downturns increase suicidality, that is, young people's, adolescents, considering, thinking about, or planning suicide. That is a very serious level of mental health problem that is particularly evident among Black youth who, as Sandy described, are so much more hard hit during economic downturns, and during this current crisis is certainly no different. So I worry about a worsening of disparities in serious mental health challenges, especially for young people, by race. And the other thing that I wanted to say, just in following up with Andrew's comments about policy solutions, to build on his comments, are twofold. One, in terms of things that we could implement quickly, one thing we should be considering is increasing the generosity and reach of the SNAP program, the Supplemental Nutrition Assistance Program, which we used to call food stamps. This is by far our largest nutrition assistance program in the United States. It is meant to be responsive to economic downturns, and it is. It works incredibly well. And for example, in my ongoing study, a little bit over half of those families are receiving SNAP. And if we made that benefit more generous, those families would have more dollars to spend on food, which they're telling us is a need that they have immediately, right away. That builds on existing technology, that builds on a very strong existing infrastructure, and that program could be expanded and made more generous. That would help millions of families right away. The other thing is to just echo Andrew's comment that in our own work, the one thing that we see as being protective against very large income losses is when these service workers were able to continue to get paid by their employer, even when they were working reduced hours or weren't working. And that could be through mandated sick pay, that could be through pressure campaigns and organizing of workers. It could be because employers felt that continuing to pay their workers was part of a good business strategy. There are a lot of reasons why employers might have been continuing to pay folks even when they weren't working. But thinking about making these systems, making these systems easier for employers to implement so that they can keep people on the payroll. Employers in the US know how to run payroll. And if the government, we can provide dollars for them to continue to do that, that is a way of getting dollars into the hands of workers quickly and immediately that may help us prevent some of these more serious long-term consequences in terms of mental health and psychological well-being.
Gotcha, absolutely, thank you. We have a question in the chat, and I can see where all three of you might have something to say to this, so I'll throw it open to whoever wants to tackle it first. The question is, how do these issues and your research apply to rural communities? And if so, how do they apply? This is from a reporter who covers Western North Carolina. And they're wondering if there are any stories reporters aren't covering that you think they really should be. So does anybody have any particular kind of perspective on how rural communities are suffering or might be suffering or may be affected by this that we haven't really talked about?
I'd like to jump in, I guess.
Sure, please do.
Yeah. So rural communities, to a greater extent than urban communities, are lacking in access to broadband. And so the suggestion that I made earlier, that we move in the direction of the universal provision of Wi-Fi, would be, I think, particularly valuable in rural communities. Also think that we typically do not devote as much policy attention or journalistic attention to rural communities, and so it's also the case that we really need to canvass what's occurring in rural communities in a similar way in which Anna and her collaborators have been canvassing a community in an urban area, because we really need to get more information about what people themselves perceive that their immediate needs are, particularly in a crisis like this. You know, Andrew had emphasized emergency relief, and I think that's absolutely vital. But I think that my fear is that unless we make certain types of key structural transformations that we have not undertaken thus far, you know, intermittent delivery of funds to folks for the purposes of trying to maintain their capacity to survive is not going to be adequate to cope with this situation. We're going to have malnutrition, as Anna talked about. We're going to have depression. We're also going to have people confronted with a high degree of desperation in terms of maintaining their families and their well-being, and that, unfortunately, frequently is a recipe for authoritarianism. So this is one of the biggest fears that I have. Another fear that I have is something that may strike people as a bit odd, particularly at a point in which people are losing incomes. But I think that there is the possibility that we could have a depression that is accompanied by inflation. And here's what I think is the possible scenario where we could have the worst of both worlds from an economic standpoint. The inflationary outcome could be a consequence of the following chain of events. If we have some degree of success in maintaining people's incomes, even at a penurious level, then folks will continue to demand goods and services. But we will not have people in the workplace actually producing a sufficient amount of these goods and services because of the constraints that are produced by the health danger. And we cannot have herd immunity in this country until there's a vaccine, because this is not a disease that people develop immunity from by having the disease. So as a consequence, we're going to have to keep people out of certain kinds of jobs until we can reconfigure them. And that means that we could have shortages of goods and services. And so to the extent that we maintain people's incomes, we might actually put upward pressure on the prices of goods and services and have an inflationary depression.
Okay, thank you for that answer, which I say these are very weighty matters. I did want to return to the rural topic for a moment, and I wanted to ask you, your survey was in urban areas, but we know obviously that rural communities often can seem invisible, and everything that you've said about social outcomes, about the pressure on child welfare, is it fair to say that those pressures are going to be felt even more keenly in rural areas where there isn't the same kind of level of services?
That's right. They certainly are going to affect rural areas. And here in North Carolina, we know that a lot of the loss of manufacturing jobs occurred in rural areas. And what has come in to replace those manufacturing jobs are service jobs. Exactly the types of jobs that I've been talking about, that Sandy and Andrew have also been talking about. So we know that in our rural areas, to the extent that people are working, they're working increasingly in service industries, and those are exactly the kind of customer-facing, customer-interacting jobs that are now being pulled back as a result of this crisis.
Greg, and if I could just add to that really quickly.
Yes, please do.
We did some work in Eastern North Carolina after Hurricane Matthew on housing recovery. I think, there are a lot of complexities about the rural issue, but one that I would add, and this is not a criticism of local government in rural communities, but because of declining populations and limited tax base, many local governments in rural communities are pretty stretched in terms of their capacity. And so, after Hurricane Matthew and all the flooding, there was a significant amount of loss of affordable housing in rural communities. And the local governments were really not in a position, either from a planning perspective or from a resource allocation perspective, to be able to step in and help address either the emergency issue or, as Sandy suggests, the longer term transition towards housing built on higher land, less likely to flood, built with different materials, or even moving towards a wealth building strategy of home ownership or something like that. So, the state was able in that circumstance to be able to step in and fund pretty sophisticated nonprofits and regional intermediaries to help make a difference. I think in this situation where kind of the bottom is dropping out for everybody, I'm not seeing the same effort to support local governments in rural communities. And I think that's something that in the near term, we're all going to have to start figuring out, because they're just not as well positioned. Also, they have particular issues like, potentially disproportionate numbers of undocumented people who aren't getting any of the emergency assistance or other benefits, are very likely to be victimized by increasing levels of racism and xenophobia as things get worse. So I think it's a great question, and there are very particular and challenging issues for rural communities.
Thanks for that. And Andrew, there was a follow-up question that I was texted that you were talking about the impact on the state, and someone said they thought you said a couple of answers ago that 90% of the people in North Carolina who are unemployed are not able to get unemployment assistance. Is that what you said? And if so, they wonder if you could just expand on that just a little bit.
Yeah, so I think the Justice Center and other organizations that have studied unemployment in North Carolina, that is that's not something that I've studied, so I'm relying on other people's work. But coming into the crisis, I think the pretty conventional number that I had seen is somewhere around 90% of the people who apply for unemployment benefits in North Carolina are denied. How that's playing out right now, I don't know. I mean, the bigger story that you hear is more about the system being overwhelmed and people being on hold for 7 or 8 hours, getting through and then being cut off, waiting in lines for many hours, online systems crashing. So that's a different kind of problem. But I do think it's fair to say that really across the country, most of our safety net programs, including unemployment, are in many ways designed to have low numbers of participation. And that's not a reality that most of us want to engage with, but it is the truth of the situation. And so when you get to a time like this where you want that system to be able to open up and accommodate the emergency need that people have, it's really contrary to what the system has been designed to do.
Gotcha, absolutely. Yeah, these are certainly unprecedented times for pretty much any system that's been set up, I guess. We're already at 10:45. I'm going to open it up again to questions in case anybody has any remaining questions that they haven't had the chance to ask. You can submit them in chat or unmute yourself and ask right now. Okay, I'm not hearing anything. Before we go, something I'd like to throw open to any of the three of you, or all three of you, if you'd like to tackle it. A question I got by email is, if there was just one step that you could take today, or that you could have the government take today, one thing, and obviously there is no one step that will solve everything, but something that for you is just the one most important thing that could be done today, what would you throw out there? And I realize that's a tough question, but if anybody wants to tackle it, then feel free.
Universal testing.
Exploring ways to provide additional support to employers to keep people on payroll, even if they're not working.
I'd piggyback off of the last thing that Anna said, although I'm more concerned about putting resources directly into people's hands rather than it passing through employers.
Gotcha, absolutely. Well, it seems like we don't have any more questions. So thank you to all the reporters and others who joined us today. And thank you very, very much to our panelists. We appreciate everybody's time. As I said at the beginning, the recording of this briefing will be ready shortly. If anybody would like that, you can email us via the release that went out, and we'll be glad to share that with you. We'll be having another briefing next week with some epidemiologists on the topic of when we will actually know that maybe we've passed the peak of this thing and it's safe to start readjusting. So thank you everybody much for your time. Please stay safe and stay well.
Thank you.
Thank you.